Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Pete, Florida. I'd like to talk to you about what is anxiety, depression. Anxiety and depression are two distinct phenomena or affective states, but they actually can co-occur or coincide together. Anxiety, depression, if somebody is really anxious over an extended period of time, their anxiety is chronic, starting to interfere with a lot of the things that they used to do, starting to get in the way of school performance, academic performance, earning a living, relationships, marriages. That we say that's chronic, and there starts to be most people that have that high level of anxiety would also start to experience some depression related to probably some beliefs that, you know, this is not going to get any better. This is a hopeless scenario. I'm helpless to do anything about it. So due to being anxious and the chronicity of the anxiety for so long, we start to see that the person actually becomes depressed more from a hopeless and a helpless standpoint. But from a mental health standpoint, both the anxiety and the depression need to be treated. In some situations, assessment of the primary disorder would probably be the protocol. Try to find out if the person has experienced anxiety for a longer period of time and try to nip that in the bud, so to speak. Try to kind of get at the roots of that anxiety, and maybe that in and of itself would alleviate the depression because the person would be back to functioning on a more efficient basis in their daily life. My name's John Bosworth, and we are looking at what is anxiety, depression.
I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, here to discuss the signs and symptoms of depression. When we talk about depression, it's important before we get into the signs and symptoms to look at what creates depression. I think most people, if you ask them what creates depression, would tend to tell you that it's external factors that cause one to feel depressed. Interestingly, the perpetrator of depression is ourselves in the form of our thinking. And thinking drives feelings and behaviors. So if you don't like how you feel, you don't like what you do, you look at the thinking that's driving that. The feeling that we're discussing today is depression, and so the thinking tends to drive that, that state of depression. The thinking we get most concerned about is the thinking that's illogical, irrational, fictional thinking, because it tends to produce a fairly severe state and tends to sustain it over time. So what are some of these symptoms of depression? I think most people are fairly familiar with the symptoms and signs of depression, but certainly a loss of interest in pleasurable activities. For some, a loss of libido or sex drive. Depression oftentimes will create this sense of helplessness or hopelessness. Helplessness, there's not anything I can do about changing the things in my life. Hopelessness is that it will never get any better. Other signs and symptoms of depression can be sleep disorders in the form of sleep disturbance, where you either can get to sleep but you don't tend to sleep well, or which is kind of insomnia at times, or that you tend to sleep all the time, and more so kind of an avoidance. Some people have trouble eating, some people eat all the time. Drinking is another behavior that oftentimes we see with depression. Depression is a sense of fatigue, tiredness, lack of energy, poor concentration. Those are all kind of the various different signs and symptoms of depression. But understand that everybody experiences depression differently, in not just severity, but the length of time that they experience depression. One shoe doesn't fit all here. Well, hopefully this information that I provide you regarding the signs and symptoms of depression has been helpful. From sunny Tampa, Florida, I'm Dr. David Thomas. Hello, I'm Dr. David Thomas. I'm going to talk to you today about steps to overcome depression. I'm a practicing psychotherapist in Tampa, Florida. Some of the materials you might need would be a quiet place, a piece of paper and a pencil, or a journal in order to reflect and to be able to record your thoughts. When we're talking about depression, like the other three blocks to happiness, which are anxiety, anger, and guilt, are nothing more than reflections of thought. And we call that cognitive depression. Now, along with cognitive depression, there's also what we call biological or endogenous depression, which is really a genetic predisposition towards being depressed. So when we're looking at steps to overcome depression, we're looking at primarily changing thinking. Now, the thoughts associated with depression tend to be H1 plus H2, which is hopelessness plus helplessness. Now, hopelessness is this idea that somehow things are just not going to get better, and helplessness is there's not anything you can do about that. So when we're looking at changing thoughts, we're going to begin to look at what are the thoughts that we have about certain life events. Now, the thinking that we're primarily concerned about is maximizing rational thinking and minimizing irrational thinking. The primary way to do that is first to isolate what is it you're depressed about, then ask yourself what are you thinking about that event, and then determine whether those thoughts are rational or irrational. There's different ways you can determine whether it's rational or irrational, but the primary way is that rational thinking, if you can remember the acronym ELF, E-L-F, E stands for empirical data, is the thought you're having fact or fiction. L, logical, does it make sense? And F, functional, does it help you achieve your short or long-term goals? Does it help you stay out of conflict with others? Does it help you to preserve your life and limb? So if it passes those three criteria, then it's a rational thought and it's probably helping you. So continue to search for the ideas that are driving that emotion. Again, I'm Dr. David Thomas, talking to you about how to overcome depression.
The first thing to say is that depression is a medical condition and is quite different from feeling sad, which can be a normal experience. A good clinical assessment will tell you if you have clinical depression. There are some general strategies that are quite helpful for depression. These include having a good diet, regular exercise, establishing a good sleep pattern, and having regular social contact, and also avoiding alcohol and drugs and managing work-life balance. The specific treatment for depression is mainly of two kinds. The first is medication, where we try and target two chemicals in the brain called serotonin and noradrenaline. There are two specific treatment approaches for depression. The first is by using medication to target two particular chemicals in the brain, norepinephrine and serotonin. Based on your particular set of symptoms, a good clinical assessment will be able to tell you which is the most helpful medication. The second approach is by use of therapy. So once again, based on your experience and your symptoms, therapy models can be used. For example, CBT, which helps to challenge negative thoughts, CAT, which helps with relationships, and EMDR, which helps with traumatic memories which are still causing difficulties.